Welcome, everyone. My name is John Salvino, and I am the chair of the Chicago Booth Finance Roundtable, and I'm president of Performance Wealth. Tonight, it is an honor to introduce you to University of Chicago professor Michael Kremer. Professor Kremer taught at MIT, taught at Harvard, and earned his PhD from Harvard. He was a MacArthur Fellow and was awarded the Nobel Prize in Economics in 2019 for the experimental approach to alleviating global poverty. Professor Kremer came to the University of Chicago in 2020, so last year. So Professor, welcome to the University of Chicago, and thank you for joining us at the Chicago Booth Finance Roundtable.
I'm very pleased to be here. Very much enjoyed myself.
Professor, could you talk a bit about your current work on vaccines? I think it's very apropos that the year we've just lived in. So I'd love to hear about your work on vaccines.
Sure. Yeah. This work started out, I got interested in this topic a long time ago from studying economic growth. And what drives economic growth is innovation. And the institutions that society has for encouraging innovation, incentivizing innovation, play a really fundamental role. And these are human institutions that we design. And a key one is the patent system. And so I started out thinking about the patent system in the abstract, not about vaccines. But I think this is an example of how thinking about economic principles can actually connect to concrete practical problems that we're facing in a big way right now. So the fundamental idea of the patent system is that patents perform a really important function of creating incentives for research and development of new products, which are, as we've seen, are vital to us. On the other hand, and here's the tension in the patent system, the way they reward the innovator is by giving the innovator a monopoly, temporary monopoly. So that tends to reduce access. In general, if you've got a monopoly, you'll charge higher prices, fewer people will buy. For vaccines, it's particularly vaccines and COVID, it's a lot more complicated than that. But if we think about the general issue, I just saw something in the Q&A. I'm talking about intellectual property rights, patents, copyrights, and so on. So how can you? So there's always debates. Always, some people saying, well, we should weaken patents. There've been calls to waive the patents on the COVID vaccines during the crisis. But then there are other people who say, if you do that, you're going to hurt incentives for innovation. And I really feel like both sides have a point here. And really what we need to do is go beyond just the seesaw between two very important objectives, innovation and access to the innovations once they're developed, and come up with new ways of rewarding innovation that will simultaneously increase access. So guess this was in the early 2000s, wrote a book with Rachel Glenister, who's also coming to the University of Chicago, who I'm married to, and it's called Strong Medicine. And what we suggested was something called an advanced market commitment. So the idea was, and we were focused, we're both economists who focus on low and lower middle income countries, or middle income countries. And so what we proposed was there are some diseases that particularly affect low income countries or lower middle income countries, and therefore there's not as much R&D incentive. Think of malaria, for example. What we proposed was, imagine that a group of funders come together and they commit in advance that if somebody develops, let's say, a malaria vaccine, then they would help pay for that malaria vaccine and purchase enough quantity to vaccinate everybody in the regions that need a malaria vaccine. And that would provide a market incentive to stimulate the same ingenuity that the private sector has for so many other medical products towards some diseases affecting some of the poorest people in the world. Well, we put out our book. Then I co-chaired a commission for the Center for Global Development looking at this. And we tried to go from that, that idea to something practical policy proposal. And eventually, a group of countries and the Gates Foundation pledged $1.5 billion for a vaccine, not against malaria. They picked a somewhat easier target. There's a disease called pneumococcus, which is a really big killer. There were already pneumococcus vaccines against the strains of the disease that were common in high-income countries, but not against the strains that were common in lower-income countries. So they pledged $1.5 billion if a company develops such a vaccine to help finance the purchases if countries put in a basic copayment. And in fact, 3 such vaccines were developed. Hundreds of millions of people have now been vaccinated, and an estimated 700,000 lives have been saved thanks to these vaccines. So I think that's an example of the power of economic tools in addressing practical problems. And I thought, wow, that's wonderful. And then COVID came along and was contacted by a number of governments and international organizations. Well, what can we do for COVID? And COVID is very different situation. We didn't recommend duplicating what was done for pneumococcus. I contacted a number of colleagues, had a meeting with some officials on a Tuesday. They said, give me a plan by Thursday, called up a bunch of colleagues, including, and we formed a group, and this includes 2 people at Booth, Eric Budish and Canis Prendergast, who are really economic theorists, actually, not vaccine specialists, but we also had people who knew more about vaccines. And we recommended the same advanced contracting approach, or a similar one, slightly different. But the idea was, commit in advance, put down the money to allow the companies to build the factories right away, and ask them for, in exchange, the right to buy, this was the US, so we recommended 300 million doses, just to be, and at a set price that would be negotiated as part of the deal. And that Operation Warp Speed, and obviously I don't want to claim that we came up with the idea for Operation Warp Speed. There are a lot of people around, but Operation Warp Speed has a lot of similarities to that proposal that we floated. And we argued that should be done not just for one vaccine or 2, but for a whole series of them, because typically we got very lucky in a way. Typically, there are lots. We don't have an HIV vaccine. We don't have a malaria vaccine. These are really hard things to produce. And it turned out for COVID, a bunch of different approaches were successful. So, the UK tried similar contracting approaches. Unfortunately, a lot of countries didn't adopt this approach. And so we in the US and the United Kingdom have been, a combination of, I think, putting in good policies and frankly, getting lucky that we now have a bunch of vaccine. And the challenge is to extend that access to the rest of the world, to places like Brazil and India and parts of Europe that are and Asia that are just still very much in the midst of a terrible pandemic. So now working on that issue and on the issue of trying to think about what we do to prepare for the next pandemic.
How did you become interested in development economics? And can you tell us a bit about what the experimental approach in economics, what does that mean? And talk about the Nobel Prize and how the work you did to be awarded the Nobel Prize in economics.
Sure, yeah, happy to. I got interested in development economics because it's just a really important problem. And there's so much, I would argue not only are there a lot of people who are living in poverty, which we all know, but it's actually a lot can be done to address that and I think the world has seen a lot of success. I'll talk about some things I was involved in, but much more broadly than that, this was, maybe I don't want to get into how old I am, but I was interested. When I was in an undergrad in college, that was the 1980s. And if you think about the progress that China or India, but it's not just China or India, much of Africa has, it was really it was really in a very tough situation with negative growth for a long time in the 80s and into the 90s. But then things really turned around, and we've seen much higher economic growth rates in low and middle income countries than we did before. So that's, I think that I'll talk about some examples of things I've been involved in, but the macro trends are very much in the, I don't want to be Pollyannish here, but there are a lot of things going in the right direction. And that turns into increased lifespan, reduced infant mortality, more kids going to school. It makes a real difference to human lives. But let me tell you about the experimental method. And so this is what Abhijit Banerjee, Esther Duflo, and I were awarded the Nobel Prize for. And at some level, it's an embarrassingly simple idea. Showing up there and then meeting the scientists who are, and you say, the truth is, this is an idea that is very simple, has been used in medicine for 100 years, and we brought it to economics. And it's actually used in business a lot now as well. So this is the idea of what in medicine would be called a randomized controlled trial. There are a lot of things that are very hard to tease out in medicine. If people, is a medicine actually making you better, or are you just naturally getting better? You can compare people who are getting the medicine. I was just talking to a physician who's here at the University of Chicago, pointed out people who get more specialist care actually do worse than people who just see general practitioners. Well, is that because the specialists are bad for you? Well, not necessarily. The people who are sicker wind up seeing the specialists. So how do you tease those things out? So traditionally, economists would come up with, I'll say very clever, I'm proud of our profession, really creative ideas to try to tease out the causal impact from other things. But of course, what's nice is how do we evaluate vaccines, since we're just talking about that? Well, there's a large sample. Some people get the vaccine, some people don't, or at least don't to begin with. And then you look at the outcomes. And if that assignment is done randomly, or there's some other things you can do that are a little bit short of random, but still convincing, then you can learn whether the vaccine really works. So, when I first got into this, that's what I was thinking the contribution of the experimental method was. But it turned out, it turns out to be a lot more complicated to do in practice than in theory. But it also turned out that I think the big impact of this was not just because it sort of allows us to isolate the impact of something from confounding factors. That's important. Tech companies, for example, running A/B tests on tweaking their platform all the time, and they're learning things from that and optimizing. So that can go a long way. But I think there's other elements of this that were important. Economists are, the stereotypical way that an economist works is sometimes pencil and paper and equations, more typically a data set, and they do statistical analysis. And if I hesitant to maybe I'm just getting myself in trouble by making a business analogy, but in business, you're supposed to get close to the customer and understand your customer. And sometimes economists would be so much in the world of analyzing their data that they wouldn't know be really familiar with the context. And if you're doing this sort of experimental work, you have to go, and I think this might be particularly important when the researcher might not otherwise know the context. You have to spend time in the field, talking to farmers, if it's an agriculture project, to teachers, to students, you have to interact with government officials, people from nonprofit organizations, get their perspectives. If it's a health project, you may be talking to people with a medical perspective. You learn things from there. So it really broadens out the set of people who are feeding their ideas into this research. And I think that's very productive. And the other thing is that it takes on very specific, very practical problems. But that can often be a window into much larger insights. but I certainly find it. You asked, how did I get into this? I think a lot of us are motivated by trying to solve practical problems, and that's both motivating, but I think it sometimes forces you out of the paradigm that you came in with. Economists will come in with a certain paradigm, lawyers with another, but when you confront the data in a very stark way, and then you're talking to people on the ground, it actually broadens, you have to be responsive to that, but it really does broaden your outlook and makes you think, hey, what's an other hypothesis? So often, we'd try something. Sometimes it wouldn't work, but we would learn from that. Sometimes it would work, but then we would tweak it and we could find it could work in a much better way. It's a constant process of iteration and refinement, much like product development, I think. And some of the things I feel like a lot of this actually is about, to return to the vaccine idea, this is about, both of these things are about innovation. So partly we're trying to develop, contribute to general knowledge. If you want to call economics a science, it's about science. But partly it's about developing better mousetraps and learning from that process. And that's a very engaging process. I should have said, how did I partly was long interested in this, but I spent a year teaching high school in Kenya, and that obviously, greatly deepened my interest in the field and I do a lot of work on education, and that was one of the reasons.
So yeah, to that point about talking about Kenya and so forth, can you use some specific examples of using the experimental approach in your research? And I read about the great work you've done with deworming, and kind of a separate topic, but I thought was really fascinating was, I was always taught that you need to charge somebody some money, otherwise they're not going to value what they buy, or so you can't give anything away for free. And I think most people took that for granted, and you challenged that, and you found that actually is maybe not so much the truth. So maybe just a couple examples of some of the work that you've done.
Sure. Yeah, I'd be happy to talk about that. So yeah, because I'd been a high school teacher in Kenya, I started out working on education, and we tried a bunch of things, and some of them were failures, some of them were successes, but modest. And then we tried something that I think we learned from some of the failures, and I think got better, but that's maybe another story. But one of the things we tried was, there's a lot of worms, like hookworm, roundworm, in the environment in this part of Kenya. They actually used to be very common in the southern United States as well. And there's very inexpensive treatment available for this. It's safe, and so what some people were advocating, including the World Health Organization, was try to reach, it particularly affects school kids. So in areas where there's very high levels of worms, or even moderately high, since it's quite expensive to diagnose, but it's very cheap to treat, just treat everybody. And so we were working with a nonprofit organization, Tiny. They started out working in 7 schools, and they decided they were going to try it, but deworming is very cheap. They decided to try it in 75 schools, but they couldn't do all of them at once, so they phased it in. And the order in which they phased it in was done deliberately, so the groups would be similar to each other. So you would, after year 1, you would basically have an equivalent of an experiment. 25 of the schools would have been treated, 50 wouldn't have. After year 2, 50 would have been treated, 25 wouldn't have. And eventually everybody got treated. So we took advantage of that to look at the impact. And because we were working on education, we knew that the medicine worked. That wasn't really the question, but we wanted to see, does this improve education? And we saw that this reduced dropout rates by about 1/4. And we also saw, or missing school, I should say, combining dropout and absence. We also saw that the benefits seemed to spill over. So it wasn't just the kids who got treated, but other kids. So at the time, they didn't know, it's since then proven safe for everybody. They were worried it might have adverse effects in pregnancy, so they didn't want to treat the older girls. But we saw benefits there. Then we looked at the neighboring schools, and we saw benefits there. And at that point, we started to conjecture, maybe this is interfering with disease transmission. When people are treated, kills the worms in their body, then they don't pass it on to others. Later on, another researcher found impacts on really young kids as well, who weren't treated, but because the community they were living in was safer, they benefited indirectly. Anyway, these were big impacts, very cheap programs, so highly cost effective. This is one of, I think, exciting things about working in the field. There are sort of $20 bills lying on the sidewalk all over the place. There's a lot of things that don't work, don't get me wrong, but part of the idea is to measure carefully, understand what works and what's effective. And then that can be taken on by governments, by NGOs, by firms. So this one seemed to work. We talked to the Kenyan government about it. They got excited about it. It took a lot of work. I then helped found a nonprofit organization to work on this. And we got invited to the World Economic Forum, sort of organized an event there. That was great. This is getting very nitty gritty, but it's Ministry of Health, Ministry of Education, got to get them working together. That's not easy. I'm sure many of you who are in corporate jobs have the same, run into the same things. But anyway, they scaled it up nationally. And then, other governments started taking notice. And first state governments in India started doing this. And then once one state government did it, and we got some technical assistance from the nonprofit organization that had, some money to provide that. And then, other state governments started doing it. Eventually the national government did it. So now, more than 150 million children are being dewormed each year. So that's, obviously very rewarding. And we say two other things. One, the long run effects, and then the other, I'll come to this point you mentioned about charging. So we followed up the same group of kids over time, and they're now, of course, young adults. And what we see is they're earning on average about 14% more. And that means the program, this medicine, it's the same medicine you see, people here, pets here get a lot of deworming pills and livestock do, but humans weren't getting it. And this medicine is, it's pennies per dose, maybe 50 cents a dose if you take into account the delivery costs. So so we're seeing, so this pays for itself so many times over. But we then, what I haven't talked about is one other step in the initial program. So the nonprofit organization, they believed, and there's lots of reasons, this isn't a stupid idea. They thought, hey, we have to charge. They had a general principle, not just about deworming, but in general, they thought, look, the client has to pay something or they won't value it. And so we persuaded them to test that idea. And this is, I think, really the advantage of the experimental method. We all have like our own ideas and theories, and often things I thought would work in education didn't. I thought deworming, maybe it'll have some impact. I had no idea it'd have a really big impact. So we said, why don't you test out the idea? And in some places, instead of putting in your user fee, make it available, continue to make it available for free. And we saw just this was because there was a research study going on. People had to sign that to give permission. So about 75% of people signed up. It'd probably be much higher in a real world program where you can opt out, but you're sort of default in. But anyway, it was 75% when it was free. It was about 15% when it was when you charged. And since this was the medicine's so inexpensive, it was a case where it made sense to make this available for free. And what was found is, we looked at I looked at other contexts like water, but importantly, a bunch of other researchers looked at mosquito nets, et cetera. I think for preventive and non-acute healthcare, there's charging even just a little bit can really reduce demand. Even very, very modest charges. And if it's an infectious disease, there's a reason why we give vaccines for free, because when I vaccinate myself, I don't just help myself, I help others. So we want to subsidize it. Same thing's true for deworming medicine or clean water solution. What water treat, drops you add to water to treat your water. I think we did get a generalizable result from here. I would not say we should just give away, agricultural equipment for free. There's a lot of stuff. I think this, but for preventive health goods that are highly cost effective in, very low income environments, it looks like making it available for free is typically pretty helpful.
It's interesting because we're talking about, what something costs. So can you maybe just put on a different hat and talk about being a social investor? And can you describe the development innovation ventures and what that means or what that is?
Yeah. So, most of the time I'm being a researcher, and I have founded a couple of nonprofits, but that's definitely a minor thing. But had this experience, and in develop. Well, take the deworming example, but I could also give examples in water. It's one thing to do a single research study, but if you really want to get something adopted, if you want to develop something and get it adopted, there's a lot more work that has to be done. There's a piloting stage before you do the formal randomized trial. Then after you do the randomized trial, there's a lot more work to do to, actually deliver this, or to work with others to deliver it. And so felt there was a gap in the sort of funding stream, at least for that. So I felt that for a while. And then the head of, this was, I guess, back in the, administration, the Obama administration, the head of US, the guy named Raj Shah was appointed head of USAID. I'd known him from work on vaccines when he was at the Gates Foundation. And he asked me to join USAID. I said, I like my research job, but I sort of made a counter proposal that they set up basically an investment fund to invest in innovative ideas in development. And so this was set up called Development Innovation Ventures. I've been involved for, just had our 10-year anniversary. And we support innovations really from anybody. This could be from researchers, but also from entrepreneurs or from nonprofit organizations or large established firms for that way. If you have an idea, and if you want to look it up, Development Innovation Ventures at USAID. I'm still involved. Government procurement rules mean I can't give feedback on individual ideas, but if you can look up, there's a pretty simple website and you can sort of submit a short proposal and put it in if you've got ideas. But so we tried to be open to a wide range of things that could scale commercially, things that would require government funding. But the idea was, before we start with small amounts of funding. Before we give larger amounts of funding, you have to go through some rigorous testing, either that it's going to be commercially successful, if it's like a social enterprise, or that it's going to have impact and cost effectiveness if you want, if you're expecting governments to pay for it long run. So in a way, it's a little bit, it's trying to take some ideas from academics, but also some ideas from venture capital or from impact invested and blend them together. And we just had when our 10-year anniversary was coming up, we set a goal of a 15% social rate of return. We knew we weren't going to make commercial returns. These are grants. So a little bit different than being in venture capital. But we want to look and see, how do we attain that 15% return? And that actually turned, that was an interesting technical problem to measure that. Turns out that just like in venture capital, a few of the, a venture capitalist is going to lose money on most of their investments or break even or something. But if they invest in Google or Facebook, they do great. And so if you look at the distribution of the number of people reached by the innovations we funded, very skewed. But then we said, okay, for some of these ones, it's hard to put a dollar value on it, but some of them we can. So we looked at the things that reached over 1 million people, and we did, our budgets, we just looked over our first $17 million of spending, our first 2.5 years. We started out, quite, modest by government standards. And what we found was just the ones that we could quantify, the 4 or 5 of the 41 awards we made over that period, the social value created that by that. I think the version of our website is 6 times as much, but we've updated it. This probably hasn't, not official numbers yet, but it looks like it's 17 to 1. So that's like a 70% rate of return rather than the 15% rate of return we were aiming for. And I think, in the process, we learned a lot that, might be, I don't know the full audience here, but some things that I think, some lessons that weren't obvious. For example, maybe should have been obvious, but weren't. I think a lot of the social entrepreneurs would focus on selling direct to the consumer. Well, one of the findings was the things that really scaled had to be really cheap. These are really poor people. They've got a lot of different needs, and so one big correlate of success, of scale, was being cheap. But then if you think about selling a really cheap product to consumers, well, the customer acquisition costs, are just really tough if you're selling a product that's under $3. So the big successes were typically ones that said, rather than sell to the consumer, we're selling to other businesses, we're selling to government, or we're trying to get adoption by government, rather than trying to go out, and build reach consumers one by one. There's exceptions to every rule, but that was one finding. We also found out, we're open to things that involve, the experimental method and formal testing and other ones and things that don't. But we found the things that involve the experimental method were actually much more likely to scale and to reach over 1 million people. And I think that if I think back to the reasons and what we were discussing earlier, I don't think that's just because, okay, they could prove they were effective and then they got other people to buy. Could have been some of that because they weren't selling to individual consumers, they were selling to big businesses or governments. But I think a big part of it was this approach of really rigorously testing your assumptions, finding out whether they're real or not, going back and revising if they're not. That can be, we see that in the tech world, that being very successful. And I think it can be successful in the international development world. And then if I want to plug my profession a little bit, in a lot of fields, if we were sort of biotech or computer science, you would think of people going from the academic world to the world of the real world. That happens all the time. Not always successfully, but sometimes with a lot of success. And I think we're now, I think in economics before, people weren't building the skills and we weren't selecting the people who could go out and work in the real world because we were selecting, can you do math very well, or can you do programming very well, which is relevant, but isn't it's not all the skills you would need. And now I think we're actually selecting people who actually are very good at setting up these randomized trials. That's a big management task, as well as it's not just an academic task. So I think that might be why some of these things have moved very successfully from academic sounding ideas to scale.
Well, we're thrilled that you're at the University of Chicago, but I'm curious, I'm sure there's multiple things that attracted you to the school, but how were we able to get you to come join us in 2020?
Well, so I'd spent time here actually very, very early in my career and, learned what a great place it was. And I think, one one aspect of that is people in different subfields of economics, but also different fields, really talk to each other. And it's, it's an intellectual place. People can talk about ideas, and that was very appealing to me. And some of the specific, there's specific. I mentioned a couple of people who I've been collaborating with, but if I think about some younger people like Josh Dean or Rebecca Dizan Ross within Booth, they're doing very exciting work, and there are other people at Harris and in Econ. But look, a big part of this for me was the opportunity to help set up the Development Innovation Lab. So the university was, I think, very supportive of the vision of saying, let's have research in development economics, often using the experimental method, but not exclusively, where we're really going to engage with practitioners, and we're going to try to solve practical problems and help do that rigorously, not compromising scientific quality, not trying to overclaim, but see if we can keep going back to the drawing board to develop things that will be useful in the real world. And I mentioned a couple of examples, but I've been involved in that multiple times in my career, on water, on things on digital agricultural extension, and it's a process that really does require a very different type of research effort, and really some resources that typical economics doesn't. You need to build long-standing relationships with partners, whether that's a government, whether that's a business, whether it's a nonprofit. You need to, where you're working together on lots of problems. You've got staff in the field on a long-term basis. You're working with people from other disciplines. So the university really made both a big commitment to the field of development economics to hire more people in the field, and a big commitment to the lab to help, not enough to do all the projects that we want to do, but enough that we could maintain a core team. That means we can establish some of these relationships that I think are going to, I guess some of the examples I've given suggest that, even that a lot can be achieved. And I think that's, not just true of my work, but I think, I think about the things that, Josh Dean or Rebecca Dizan Ross are doing. And, I think these things can potentially have a very big impact. These are risky bets. I won't claim otherwise, but one of the things I was excited about the Development Innovation Ventures at USAID was seeing, hey, this is actually delivering very high social returns, because you get a few of these bets. Some of these things have reached, India, there's a software for community health workers. This is something that not my own research, but something that Development Innovation Ventures developed. That's been scaled up by the government of India to their 1 million plus community health workers. You get a few wins like that, and that makes this type of effort very, very rewarding. So trying to institutionalize that and the opportunity to do that, that was something that the University of Chicago got behind, and that was a big draw for me. Yeah.
What can we do? The people on this call, is it USAID or so forth? Are they in need of money, or are they? What is it that? What would you encourage us to? How do we get involved if we want to help out with alleviating global poverty? It's a kind of a daunting task, right?
Yeah, I think that there are, it's a task that can definitely feel daunting because there's so many people involved, and facing very severe problems. But I think what we found, and through the experimental approach in general, the work that not just my work or Abhijit or Esther's work, but it's now really grown. The field's really grown, and what we find a lot of stuff that doesn't work, but we find a lot of stuff with just extraordinarily high returns. And let me break this out a few different ways people can help. So if you're looking for for things that would make a difference. You can, there's now, I mean, I could, I'm big on deworming, I'm big on water treatment and so on, but there's a list of things, and there are organizations out there that compile that evidence. And, if people are interested, if you feel free to email me and I'll try to put you in touch with, various things. And this is true in multiple sectors. People may have an interest in education or health, but they're within every sector, there are things that have just been proven very, very effective. And so that's one thing. I think investing in the process of innovation, there are, obviously we'd welcome, funding at the lab, but, there's Poverty Action Lab at MIT, there's, Berkeley, Harvard, there's lots of great places out there doing this type of research. They're not, they're also nonprofits that are systematically exploring new ideas. So whether you're investing in things that have been proved to work or you're investing in the pipeline, I think there are good investments out there. In terms of things that people can do personally, that is, I tend to think that, the basic, obviously there are exceptions. If you're selling cigarettes, I might not say this, but for most businesses, you have to think about, are you going to get involved in the developing world? And there's lots of tough things about that. But I think most businesses are bringing a lot of value to people. That's why they're successful businesses. And I think thinking about just establishing offices or production in, not just in the easiest markets, but in other markets, I think that is a way that people can be very useful as well. And I think it can also be a profitable business strategy, given the long-term. It used to be that high-income countries, low-income countries were growing at comparable rates, but now you really see catch-up, and these are the markets of the future. So I think just doing your normal business there, and then some people will be interested in being social entrepreneurs, and it is a tough thing to do, but you can make it is an area where you can make a big difference, and sometimes rapidly, sometimes slowly. But if people are interested in the field, I encourage them to do that.
So obviously a key idea with economics would be incentives. So I guess just kind of circling back to your earlier point about just patents and making that kind of, so I guess the idea is a communicable disease that, where is there a market? Is there money to be made? I mean, how do you get somebody, obviously we think about it, and I know I read about some of your work and just talking about a vaccine. The problem with it is then you cure something versus selling a drug, right? A drug you get to sell and sell and sell. So there's more incentive there. So are we where we want to be with kind of creating those incentives so that we're tackling these diseases, or is there more work to be done, or how do you see that?
I think there's a lot of work to be done. One of the, sometimes out of crises, we get all sorts of, either acceleration of adoption of innovations that were underway before, or we get, brand new innovations. You think about, penicillin coming out of World War II and radar and so on. Out of COVID, the COVID crisis, we're now doing all sorts of things by video conference, and that's been adopted much more widely. But I would argue that there's a little bit of a meta innovation here, which is finding new ways to encourage research that actually also encourage adoption. Because obviously in the middle of a crisis like this, you don't want to just get the vaccine developed, you want to get it into people's arms. And I think this advanced contracting approach that worked for pneumococcus and I think was successful. We could have done it better, but we made lots of mistakes. But at some level, it was very successful for the U.S. Operation Warp Speed and the similar UK efforts. And I think this might offer a new paradigm for, it's not going to work in every sector, but for this advanced contracting. And there are other ideas we could explore, some of them a little bit out there, like buying out patents and putting them in the public domain. That's not going to work for vaccines for various technical reasons, but it might for other things. But I do think we need to think about incentives. And unfortunately, there can be big gaps between what's needed to do and the incentives to do it. I'm actually going to, just came out with a new paper today. I'm going to just show you a figure from that to come back to the vaccine context, or at least I'll try to share my screen and do this. So, okay. Okay, so this is a fairly complicated looking figure, but let me walk you through it. Okay, on the horizontal axis, it says mean neutralizing antibody level. Okay, that is basically how strong your immune response is when they measure it, sort of, lab-based measures. Okay, the vertical axis is how protective the vaccine turned out to be. Okay, take a look at the data points for this are the sort of circles with, I don't know if I can get my mouse there, are the circles with the circles with a shaded area between them. Okay, these are the different vaccines, Moderna, Pfizer, Novavax, AstraZeneca, Johnson & Johnson, okay, plus some ones that you might not have heard of. That's an amazingly tight relationship, it turns out, okay? We're suffering, we got enough vaccine for the US right now, but most of the world doesn't. Well, here's the amazing fact, which is when we tried vaccines, when they developed these, they didn't know what dose to try in the large scale trials. They tried out a few things and they picked something, and they tended to go with a high dose, looking for something that's going to work. Let me show you these two green points here, for example, or I could even let me show you Moderna, even stronger. This circle is that if you look down here, that says the immune response. Okay, now look at a half dose. That's that solid point. Okay, if you plot where on the chart that would be, based on the immune response, you can see that would be 95% efficacy as well, basically. That seems to be true for a lot of vaccines, that it's very, very close, basically indistinguishable what the predicted efficacy would be. Now, I'm not going to argue, the US should go out immediately or anybody, and based on this chart, go, this is a medical decision, et cetera. But what I will argue is we should check this out. If you could manage with a half dose, or look over here, even a quarter dose, more than 90% predicted efficacy. If we could, imagine if European countries or Brazil or India could have 4 times as many doses as they now have. We've done some epidemiological modeling. With these predicted efficacies, you'd have a dramatic impact on the epidemic of having that many more doses. And that even if you lost some efficacy and that didn't turn out to be this high, you'd still have that. So I'm not going to argue. There are all sorts of reasons why this graph might be misleading, but we should be doing that research. But the incentives are not there, and in cases like that, where the private incentives don't match the public incentives, that's where philanthropy or government should step up and fund the additional work. And what you may be able to see here, I'm going to have to peek myself. The sample sizes, these tests of the immune response, these are very cheap. They deliver results. There are a few hundred patients, or in this case, many of these cases, less than that. They deliver results in weeks. These are not, you don't have to wait to see whether people get infected or not. You're just testing the antibodies. That's something that there's a trial going on in Belgium right now. We could do this for many different vaccines, many different dosing levels. And then, the next step would be, and when the UK went to what's called first doses first, a longer gap between the first and second doses, they did it based on this type of evidence. So that's up to each, the medical authorities in each jurisdiction. But there's now in Brazil, they're actually trying half doses of AstraZeneca. Well, that's a little bit more, that's a bigger decision to do that type of trial. But if this pays off, well, let me say first, if it doesn't work out, people can still take the full dose. Sometimes it might have to be a different vaccine. There's some, working with experts in this area, but you can still take it if it turns out this isn't providing protection. But if it does provide the protection at the results that this chart suggests it might, well, that's something that could have dramatic impact for the whole world. So I guess to put it in economics or business language, I think there's a huge arbitrage opportunity for things that won't necessarily pay off for an individual company, but would pay off from a social value perspective. And what we're trying to do in the lab, what tried to do with USAID on development innovation ventures, what I tried to do in a lot of my own research is to seek out those arbitrage opportunities, and then to work with the decision makers to see if we can plug them. And in some cases, that like on water, I'm not going to be involved in these medical trials, but things on water, we actually worked to develop a new product and to roll it out, and there can be a very big payoff from that. But we do need to not just rely on nonprofit organizations and government funding. We need to systematically create incentives so the private sector will go after this as well. And that's what advanced market commitments we're doing. I think we could do a lot more in that area as well. So that the pharma companies themselves, next time we have a pandemic, they're going to have the incentives to say, hey, we might face shortages. Let's not just test the high dose, because let's also test lower doses.
Yeah, I think with current events we read about, and we're all University of Chicago MBAs, so we read the Wall Street Journal, read about the dispute or discrepancy between the United States with the patents and basically waiving the patents for a period of time versus the European Union, the Eurozone. How do you, any other topics that you feel are kind of in the news today that fascinate you or that you're keeping a tab on, and maybe how those things will play out? And the other topic was, I believe I read about England, and they're talking about maybe cutting back on their foreign aid budget, so things of that nature that are interesting to us as readers, but I'm sure you're seeing the same things in the news.
Yeah. So look, let me start with the UK. I mean, the UK, they were spending 0.7% of GDP on development investments, and that was that made a big difference. And they were pretty effective. They were pretty effective at it as well. So they did spend a lot on what's called neglected tropical diseases, which includes deworming, but some other very high impact, very low cost things. And they cut back from 0.7 to 0.5% of GDP. And of course, we all know there's some fixed costs you have. So that means that there are commitments that you've entered into that you're legally obligated to, et cetera. So when you cut back like that, some areas get dramatically cut. And, that includes neglected tropical diseases, which I think, it's like a 90% cut in that area. That leaves huge gaps. So I think that's, really, I realize it's tough economic times, but cutting back on things for some of the poorest people in the world is, I think it's unfortunate. But I think there are things that others can do to try and help step up. And I'm hoping that, the UK will go back to its target, which is way above where we are in the US of 0.7% of GDP. Let me talk about the vaccine, the push for vaccine waivers. This is an example of what I started out with, which is if the debate is all, do we make intellectual property stronger? Do we make it weaker? You're pitting two very important goals against each other. And that's why I feel like you need to go beyond that simple, just having that one policy instrument. And so I think that in the case of, as we've discussed, in the case of vaccines, if you want to, I think there's a way we can both, if we just waive the patents, that's going to, I do think that will have a, next time that a pandemic hits, or if companies are thinking about, do I go into the pandemic preparedness business, it's going to be discouraging to them. And we've seen what these vaccines have done for the US and the UK, what they're going to do for the rest of the world. We don't want to discourage innovation. On the other hand, we want to get, if there are companies that could be producing this that are not, and we want to create incentives to get access to as many people as possible. So how could you do that? Well, because you can understand why if you're in India, you're Brazil, you're in South Africa, you don't want patents to possibly get in the way. So I think the solution is to say, let's put incentives out there to, if you can find a way to increase production, we're going to offer to pay for that. And that might incentivize, some of these deals between some licensing deals. If you wanted to, you could specifically reward licensing. I would prefer saying, you come up with any proposal to get more people vaccinated, submit your proposal, and we can potentially fund that. And this graph, look, I think the big message from all of our research on vaccines is get lots of shots on goal. We didn't say invest in mRNA vaccines or invest in protein subunit. It was invest in everything and hope that one of them comes through. And that's what we should be doing now. Obviously, there are going to be some terrible proposals out there, but I think if there's an opportunity to ramp up manufacturing through improving yields, through licensing to firms in other countries that might be able, let's set up the funds to pay for that in exchange for the product. And then, this one I have up here, I'm certainly not suggesting an exclusive approach on this, but, let's fund the tests. I'm not saying let's start putting, 1/3 doses in people's arms yet, but let's fund, that's a medical decision. Some countries might come to that decision, but let's fund the tests to find out if this would work. And, if somebody submits a proposal, whether that's a vaccine manufacturer, a research institute, or, a government that wants to try this, let's make sure they have the resources to be able to try it. And then we can learn as a world. And if this does work, that could have tremendous impact.
Professor, thanks. I respect your time, and it's at the hour at this moment, but we could keep going, of course, when it's very fascinating, but we certainly appreciate you joining us, and would love to have you again someday. And I would love to hear more about the research that you're doing and the results that you find. And so we appreciate you very much.
Great. Well, it's been a pleasure. And if people want to send emails, feel free to do so. So great.
Okay. Well, great. Thank you again.
Thank you. Bye.
All right. Take care.